A 4 years old child present with 4 to 5 days history of feeling generally unwell and also having sore throat. On examination, there is marked cervical lymphadenopathy, oropharynx covered with thick gray membrane which bleeds following attempted removal. What is the most likely diagnosis? So only 4-year-old child present 4 to 5 days of generally unwell and sore throat, and also there is cervical lymphadenopathy and oropharynx. It is covered by membrane and it bleeds when attempted to remove. So what is the maybe the diagnosis? Here the options are acute streptococcal pharyngitis, infection with Epstein-Barr virus, diphtheria, blood weak angina, and ingestion of the caustic soda. So what may be the answer? Now see, the infection with diphtheria, it classically causes systemic illness and which lasts for several days. And the tonsil and pharynx can be covered with thick gray membrane and it bleeds when they attempt to removal. So it is the main important diagnosis point that there is a thick membrane and it bleeds when attempted to removal. And there is also marked cervical lymphadenopathy. Some individuals can have a bull's neck appearance and death occurs when there is the airway compromisation. That means sometimes what happen, the membrane or pseudomembrane, it goes in the downwards and finally it obstructs the airway and it may cause death. So what is our answer? Our answer is the diphtheria. In case of the diphtheria, there is a thick gray membrane and this membrane, under the membrane, bleeds occurs when this attempt to removal. So it is the main diagnostic point for the diphtheria. And also here we can see there is generalized unwell, and also there is the sore throat and cervical lymphadenopathy. So these all are in favor for the diagnosis of the diphtheria. Other options here, such as the acute streptococcal pharyngitis. In case of streptococcal pharyngitis, there is only the fever and sore throat, but there is no thick gray membrane. Infection with Epstein-Barr virus also, this also affecting the neck area, and it causes the sore throat and cervical lymphadenopathy, but in this case also there is no membrane. And Ludwig angina, in case of the Ludwig angina, it is one of the acute infection and the site usually different and usually the submental and submandibular area, and ingestion of the caustic soda, it is also not true. So the final answer is the diphtheria.